And finally, after 7 years of infertility, I became pregnant and I was so happy. First miscarriage, 1 became 2, 2 became 3, 3 to 4, a nice number. But no, I had 5 miscarriages. And on the 5th miscarriage, I was this close to losing my uterus. My son came up to me and he was like, "Mummy, stop scrolling." And I was like, "Why?" And he said, "Because it's not good for the baby." And I said, "There is no baby." And he said, "Why does it always happen to us?" I felt I had a choice. Do I now become a depressed housewife, yearning for something that she can't? Or do I become the therapist I couldn't find for myself? It's so difficult. You want a child, but yet you have to take this tablet, and this tablet will make you miscarry.
What would you say to that Shanela? What would you tell her?
That there's nothing wrong with her. Everything is as it should be. And this struggle is a struggle that's going to make her.
Welcome to the Dr. Ayat Mekki podcast, where healing, transformation, and manifestation begin at the root. Today's conversation is one that will speak deeply to every woman who has had the desire to conceive, to nurture life, and to reconnect with her body in trust and not in tension. My guest today is the incredible Shanela. Shanela is the founder of Holistic Pink Ups, a holistic fertility expert who's helped countless women conceive successfully and naturally after years of struggling with infertility, IVF fatigue, and emotional burnout. In today's episode, we explore the mind-body connection and the body's innate ability to heal itself to prepare for a successful pregnancy. If you or someone you know has ever struggled with infertility, share this episode with them. So let's dive in. Hello, Shanela. Welcome to the podcast. I'm very happy to have you.
And thank you for inviting me. I feel very honored to come here.
So, Shanela, tell us about the reason why you do what you do, or reasons.
I have many, as you know. What it was is I have become the therapist I couldn't find for myself. And I suppose a lot of people can even say that about themselves. But I myself, I got married and I wanted to have children, and I had my life all planned out. I was going to marry, have children, and just enjoy my life. But Allah had different plans for me. And what happened was that 1 year, 2 year, 3 years, after 5 years of waiting to see the 2 lines on a pregnancy test, I was always searching and looking for the positive test coming and to be pregnant, but it wasn't happening for me. And finally, after 7 years of infertility, I became pregnant. And I was so happy. I was like, yay, I've done it. And alhamdulillah, I was blessed with a baby girl. And then the aunties started asking, where is the boy? So I was like, I have to do this again. And then alhamdulillah, Allah blessed me with a baby boy. Then they said that your children need companions. And so that then led me, I think that led me to my first miscarriage. 1 became 2, 2 became 3, 3 to 4, a nice number. But no, I had 5 miscarriages. I suffered from 5 miscarriages. And on the 5th miscarriage, I was in Pakistan and I was this close to losing my uterus. And the doctor, she shouted at my husband and my sister-in-law and said, what do you want from her? Like, she's given you a girl and a boy, now just leave her alone. And subhanallah, I was registering and I was thinking about what was happening with me, and I was just scrolling through social media lying in my bed in Pakistan, and my son came up to me, and he was like, he was 7 at the time, and he was like, "Mummy, like, stop scrolling." And I was like, "Why?" And he said, "Because it's not good for the baby."
Wow.
And I said, "There is no baby." And he said, "Why does it always happen to us?" And it was at that moment that I felt I had a choice. I was at a crossroad. Do I now become a depressed housewife, yearning for something that she can't? Or do I become the therapist I couldn't find for myself? And do I become somebody who can help women conceive successfully and naturally? And that's when Holistic Pink Ups was born.
Wow. It's incredible how your own struggle with infertility has led you to become someone who helps others, and you became the therapist you couldn't find.
Exactly.
I would like to take you to the 5 years where you were trying, if that's okay.
Of course.
How did that feel like? What were the overarching emotions during that time?
The belief system that I picked up at that time was, what is wrong with me? Why aren't I good enough? Like, there's thousands of women that get married and have children. There's thousands of women that maybe have a one-night stand and get pregnant. Now, I really want to get pregnant, and why isn't it not happening for me? And then it's like questioning your own abilities. Like, what's happening with my body? Why is my uterus not doing what it needs to do? What do I need to do to get pregnant? And then I started understanding ovulation, and I started looking in the internet and looking for the science, looking for, like, I treated it like a project. Project Get Shanela Pregnant.
Well, those are very hard emotions to go through, and it seems as though you felt like something was wrong with you. That's what I'm picking up from what you were saying.
Exactly, yeah.
What would you say to that Shanela? What would you tell her if you were able to talk to her now? What would you like to tell her?
I would like to tell her that there's nothing wrong with her. Everything is as it should be. And this struggle is a struggle that's going to make her. There is light at the end of the tunnel, and she's got this. There's always hikmah behind a delay, but we don't see that.
What does hikmah mean?
Hikmah means there's always wisdom behind a delay. There's always wisdom, there's always a lesson, or there's always something that you have to learn in order to receive that blessing.
Mm-hmm. That's beautiful. Do you feel like you have reconciled what happened in the past? Like, you've reconciled with it? Do you feel like you now know exactly why it happened?
I really wish I could say yes. But life will always throw things at you. There are lessons to be learnt. And I feel as though my healing journey is like an onion. And there's so many layers to this onion. And I get new revelations with every time I upgrade my belief system. Every time I upgrade my own personal development. I'm still a working project.
You mentioned belief system a few times. I'm wondering, like, when you talk about belief system, what is it that you mean? What does it mean to you to have a belief system and to update that belief system?
A lot of people that have got belief, that have got Allah, and as Muslims and even people that believe in a higher being, they will always turn to Allah to understand what is happening with them. It's a source of comfort. But I also find that my perceptions, so my perceptions can be like Snapchat filters. And whichever filter you have, that's the projection that you're going to see. And so when you try on a new filter, you get a new perspective. And then I can choose whether I like that perspective, whether I want to keep it, or whether it's outdated and I can take it away.
Can you give us an example of a belief you had versus now? Like what changed in that belief, and how does that process look like? Because I'm very interested in how you described the belief system.
Right. So in my practice, I have what I call the 3 B's to a baby, and one of the B's is belief. And I use this quite a lot, and I've realized in my workings and in my own journey that there's like 4 main beliefs that I've seen with all the women that I've helped with and my personal reflection. And one of them is feeling unworthy. So and feeling unworthy can be sometimes to do with control, because you want to control your body to give yourself a baby. It can also be sometimes you have the guilt and the shame because you're like, why isn't my uterus giving me what I want?
Which is the question about what is wrong with me.
Yeah, what is wrong with you? Yeah. And so when I understood that this belief system is one of my blockages, then I had to work on myself, and I'm still working on myself with the actual belief system of being worthy. Because I had one really interesting client. She was struggling to get pregnant for 12 years. And when she gave birth, she came to see me after the birth, and I got to see the baby, which I completely love when I get to see them and I get to see the ladies. But she was confused because she still had the belief that I'm not good enough. Like, I don't know what's happening with me. And she was so confused, and she asked me the question, Shanela, why is it when I witnessed the birth of my nephew, I had so much joy and love and feelings, but when I've given birth myself, I feel numb. I feel that there's no connection. And this was really important for me to understand, and I felt like it was as if she was mirroring my own feelings and my own journey, because I very much resonated with what she said. And it's also, and I explained to her, it's because you've been in survival mode. You've always wanted this, and now that you've got it, you almost can't believe it. Like it's something that you've wished for, that you've prayed for, you've got up for tahajjud, you've really asked with all your heart and soul, and even the people around you have asked for this. And now that you've got it, your body, your nervous system just goes into overload, and it doesn't know what
it can't handle.
It can't handle it. It can't handle it.
It was like too much on the nervous system. And this is what happens when we manifest something we've been waiting for so long. Your body sometimes will act up, and you will feel unsafe because you are manifesting something that you've longed for, but your body doesn't know how to carry it yet. Your body doesn't know how to handle it yet. So there's an adjustment period where you teach your body to feel safe with this new blessing, and eventually you do feel safe. That's beautiful. I love that story, and it just goes to show you that sometimes we get so caught up in our own trauma and our own wounds that when we receive the blessing, it becomes too much for us, because we're still in that hustle survival mode and finding a solution.
And also when she came, she didn't have the belief that she could get pregnant or she could be a mother. So even her coming to see me after 7-8 months, a couple of treatments, she actually got pregnant. And that she couldn't process it. Because in her mind...
her body couldn't do it.
No, because in her mind she really wanted it, but yet it was... it's so, I think an infertile woman can really understand this, that you really, really want it, but you can't wish for it because you're scared what happens if it doesn't happen. Like I've yet to find this kind of, it's such an opposite frequency, but it's protecting you. Because the frequency is, I really want this, but I'm scared to receive it.
It's waiting for the other shoe to drop almost. Like
Yes, yeah,
the
yeah.
fear of when things are going really well, you can become so afraid of things all of a sudden like stopping or going badly, and that feeling is related to the wounding and the previous trauma you've experienced in childhood. So it's almost like waiting for something to happen because it's too good to be true.
Exactly. You've taken the words out of my mouth. Like it and that's what it was, is that it was too good to be true, and she got it too soon, or in her mind. Even though it's been 12 years that she was yearning for it. And I find that even I am still updating my system. I am still accepting what has happened to me. But yet I have the honor to hold space for other women that I can help as well.
You know what's beautiful about your journey is that you are still evolving and working on yourself. And you choose to do that, even though you don't want to conceive again or anything like that, but you still work on yourself to help yourself and help your clients. And your clients trust you because you are authentic, because they can see that you're vulnerable with them. And vulnerability and authenticity go a long way when you're working with a client in such an intimate way.
It's because that's what it is. Is that when they come to me, I like going back to the 3 B's. The first belief is brain, following a logical path, because it's
the first B is brain.
Yeah, the first B is, so the first B that I help with is actually what I call the brain. This is the logical path, and I call my program the 7 steps to a successful pregnancy. And some of the steps are talking about your situation, talking about supplementation, talking about the science, and also talking about the shedding of the endometrium lining. So then it's ready for the implantation of a healthy embryo, and it's also prepared for that.
That makes a lot of sense. You work on mindset and body at the same time. So you take that's why it's holistic. Your clients you work with a client as a whole and not in parts. You don't just look at where the fertility issues, you look at the holistic. Do you also work with your clients on their emotional journey?
Yes, I do work with the women with their beliefs. I give them what they need to fill up their cup. And I always say that if you can't believe that you can be a mother, then borrow my belief in your abilities. Borrow my belief in you, because I believe that every woman can be a mother if that's what she really wants.
You truly believe that every woman can conceive if she wanted to?
Yes, I truly believe that every woman can conceive if she wants to. But I work with honesty and integrity. So there are some instances where I have to be honest and I have to say, listen, it's a hard case. I think that I might be able to help you, or I can't help you. It's the hardest thing for me to say, but I need to work with honesty. And I also say that when I'm not sure, I say, listen, have one session, let's see how your uterus reacts, and then we can see what we can do. Because even if she doesn't conceive, she can nurture her uterus so it becomes healthy. And a healthy uterus will also mean that you have a healthy menopause. that you have a healthy feminine energy. One of my clients, I remember, the stories are coming, that she did the 7 steps to successful pregnancy and she did the physical treatment. And she said, I feel more feminine. I feel more kind to myself.
Is that because the hormones become balanced?
Yes. Because when you have a balanced womb, you have balanced masculine and feminine energy. You have the balance of progesterone and estrogen. And it's exactly how your body should be.
There are women who can't get pregnant you've come across.
Yes.
I imagine that that's a very hard conversation to have. But is it always like a no, they can't conceive? Or is there, like, do they just need more time? Because you did say that every woman can conceive.
Yes, but we also need to be practical. Mm-hmm. So sometimes they have women where there's a physical defect of the uterus, so that's then becomes harder for them to get pregnant. There's sometimes where you have women with very, very low AMH levels, which is basically they have very, very low eggs. The body hasn't produced enough eggs for them to conceive. And then there's some ladies, and they don't understand that, like, their periods have disappeared now for 2-3 years, and then it becomes harder. So again, like, yes, we have to have the desire to get pregnant of a healthy uterus, but we also need to work with integrity.
I absolutely 100% support that. And the reason I'm asking like multiple questions here is because you did make a very bold statement in that every woman can conceive if she wanted. This does mean that there are women who can't.
Yes. But I would say majority of the women there. But again, we have to have this. We have to have the strong belief that I can do it.
Mm-hmm. Mm-hmm. So that plays a big role.
Oh yes, 100%.
Do you remember your first successful case?
I do.
Okay, can you tell us about that one?
My first successful case was actually a very good friend of mine, and her daughter is now 15 years old.
Wow. So that was 15 years ago.
Yes.
Mm-hmm.
I studied this subject, and she suffered from PCOS, and we were talking about it, and I was like, let me just cup you and let me just give you a treatment. And I remember we just did the treatment like on the room floor, and as I put the cups on, she could feel popping, and it was really strong. And so then we did all the popping, and she felt really, really good. And then she went back, and she got pregnant straight away.
Wow. Wow, so that's 15 years ago.
Yeah.
And since then?
Oh, since then there's countless, like alhamdulillah, so many ladies have come to me, and so many have conceived. And again, this is also really important for me to say that, you know, the women, they give me a positive pregnancy test and write a little message, because again, I feel that honesty is really important, and for me to showcase the results.
What do you think is the most important cause for a successful treatment journey with your clients, when it comes to your clients?
That they follow the protocol. Mm-hmm. Because I find the girls or the ladies and even the men, the ones that look at my protocol, follow it, and also believe in it, they are the ones that will get pregnant between 6 to 9 months. And then I have the other ones where they will half-heartedly follow the protocol, and it might take them a bit longer, or sometimes it's a little bit like difficult to conceive. And some people will just get the information and have no implementation. And I say that I possess no magical powers to give you a child. You have to do the work. I liken myself to, I'm like Google Maps. Okay, I'm the annoying lady at the back saying, turn left and turn right and do this and go round the roundabout. That's what I'm saying, and it's up to you to follow the instructions. Because when you go somewhere and you're not following the instructions, are you blaming the map, or are you blaming yourself that you've not got to the desired destination? I remember I had one lady, and she said, Shanela, I'm not doing what you've told me to do. Is that okay? And I said, yes, it's completely fine. And she felt relieved that, okay, that's fine. Because I said, I'm not the one who wants a baby, it's you.
You're absolutely right.
And I sometimes even say to them that I will test your desire, your true desire to have a baby.
Mm-hmm.
Because you have to implement the information. You have to implement what I've said. And I learn a lot sometimes from the middle category, because they would be doing everything except one.
Do you think that that's related to their fears? Or is it that because they really want to conceive, right? They come to you, they invest in themselves, and they don't follow the instructions. What do you think that is related to?
That's a really interesting question, and I've never really thought about this. It's actually related to, is this, even though it's my desire, but is this on the number one priority? Is it number one on my priority list?
Mm-hmm. Or is it, I am protecting myself. If this doesn't work, I won't get disappointed. Because many people self-sabotage.
The self-sabotagers, there will be a time where they will seek the help. They will say something on the WhatsApp conversation that we're having, or they'll say something on a phone call that we're having, and I can easily I then understand that, and I become a little bit more gentle, a little bit more slower for them. But there are people that are basically expecting, because they see all the positive pregnancy tests on my Instagram and on my social media, they automatically assume that they have a treatment with me and they get pregnant.
Oh, okay. They don't expect that there will be work to be done.
Yes. Even though I tried to make it clear, but some people just that information just doesn't get downloaded.
You said the three B's are belief, the brain, belief, and the third B is?
Body.
So what about the body?
So I have to work physically on the body.
Oh, okay.
So I do acupuncture, Chinese medicine, cupping, and these are the modalities that I use the most. So I have made my own concoction using these three, and also womb massage. So using these four very powerful modalities, and I have adapted them to the infertile woman.
Do you have a name for your technique?
I call it the fertility flow map. So massage, acupuncture, and personal self-care.
That sounds really helpful. It seems that you've found a method that works and that includes the whole body, mind, and brain.
Yes.
Okay.
Yeah, but I had to call them B, so then instead of the mind, I call it brain. And so, and I find that this combination of the three things together, just it's wonderful to see the women transform and blossom.
What would you say is a woman's most common block in conception? Is there something in common with all the women who came to you with infertility? Like, if there's one thing in common with all of the women who came to you with infertility, what would that be?
I wouldn't say in common. There's lots of like categories. So there sometimes is a physical block and sometimes there is a mental block. So like with the physical block, like women are suffering from endometriosis, from PCOS, from unexplained infertility. There's always an answer to the physicality of what's wrong with the womb. And then you have the women that come to me with the mental block as well. But they might not understand that they have a mental block, but as we do the work, they start understanding, because then things start unraveling with them.
Okay, that makes sense. What is the role of men in the holistic journey with your clients?
So men are actually essential to the infertile journey, because it's not just a woman's problem. It can also be a man's problem. And also, when the woman is going through an infertile journey, she needs the support of her husband. And I do find that a lot of couples are very surprised and some of them are very happy in the fact that when I do the 7 steps to a successful pregnancy, the husband is invited to come and sit and listen to what I've got to say. And I find...
So you demand that the husband attends?
I strongly advise.
Okay.
If I could demand, I would.
Okay, so you strongly advise that the husband attends the session?
Yes.
Okay.
Because then he understands what his wife is doing. He understands why she's doing this, and he will have softness towards it, and he will also understand it. And it's sometimes really nice, because some of the men, their wives go into like manic mode, and majority of them will phone me up and they'll say, yes, I was going crazy, and my husband just said, why don't you just phone Shanela? So I do have that. So it's like, okay. And so they understand, because sometimes as a woman, you don't understand. You're so used to being in this anxiety loop.
That's true. Especially if you're struggling with infertility. It's a deeply, deeply personal and heavy journey. It's something that it is very heavy to carry. And I understand that a woman would feel as though she's, going crazy.
And also she's used to doing it on her own. She forgets that I am available.
She forgets that you will support her.
Yeah, she really does. And so then, and I really, and when you see the couple dynamics, and you see them supporting each other, like subhanallah, it's just so beautiful to see that there's good men out there.
Yeah, and it's also this contributes to a healthy pregnancy, doesn't it?
It does. 100% it does.
Mm-hmm. What if a woman isn't physically available to come to you? Would you still be able to help?
Yes. So if the woman is in the UK, I insist that she comes physically to see me, because the brain and the body together is so powerful. But I have now developed the virtual option where I can go through the 7 steps to a successful pregnancy with anyone from abroad on Zoom. And this really helps, but there is an element of it taking a bit longer, because there is so much power in the physical treatment, in physically removing the blocks, in physically using the acupuncture points. And because my protocol is developed by me, it's not conventional that other people can do it yet.
Yet, okay.
And also what I also find is that, and I also have, for the USA clients, I have a therapist that I have teamed up with in New Jersey. And so I do the 7 steps to a successful pregnancy consultation, and she does the physical treatment. So that's like a little experiment that's happening in the USA. But alhamdulillah, we've managed to get 4 pregnancies.
That's amazing. Okay. So this means that you can teach the women to apply and practice the 7 steps, and this like via Zoom, and this would work. It would take longer, but it would work.
It would work for the cases that are like, I always categorizes my cases. Some of them are easy, some of them are okay-ish, some of them are a bit difficult, and some of them is like, alhamdulillah, it happened. And so the first 2 categories are very easy to do via Zoom.
Okay, and you've had success?
Yes. Again, what happened is in COVID, there was a girl, and she really wanted the information. And her father-in-law got COVID, so she couldn't come physically to see me in the clinic. So then she was like, but Baj, I can't wait this long. Can you please just do it online? And I was like, okay, let's see. And so we did it online, and I realized it was it helped her. And she goes, no, I really found it helpful. And then COVID was the pandemic lasted a bit longer, and there were people that were desperately wanting to get onto their fertility journey. And plus all the IVF clinics had closed at that time. So I found myself doing the online consultation, and there was one woman, and she conceived twins.
Wow.
And I've never ever touched her physically.
That's amazing. She just applied what you told her.
Yes.
That's amazing.
And then I was like, whoa, this is powerful. I was astounded, because I just thought that I gave them the information, they'll implement, their womb will be ready, and then after the physical treatment, then inshallah, they will get pregnant. I didn't think that they would. But then that also enabled my protocol, because a woman comes to see me the first time, and then after 3 months she comes and sees me. And that was the refining that I did during the pandemic. Because I realized that, hang on a minute, the women are getting the clear out with me without me physically treating them.
Yeah.
And it just made me understand that the information, the protocol is so powerful, but it still needs the physical treatment as well.
So you are one of those who contributed to COVID babies?
Yes. I hold my hands up.
That's amazing. That is very powerful. How important is emotional healing in the treatment journey?
I think it's really important. I find that some of the ladies, the emotional healing will happen like tangibly. It will happen very, very naturally. But some of the women that are seeking the emotional healing, their journeys might become a little bit more quicker. Because it's not essential, but it supercharges the actual journey.
So it makes it quicker, like it gives them quicker results?
Yeah, because it allows the body to prepare itself and shred the old beliefs. And also because a lot of trauma is held in the womb of women.
Mm-hmm. That's absolutely true.
So if you are physically trying to get the womb to clear out, it will also, on a knock-on effect, it will help your belief system. Or if you are working on your belief, you will find that your periods might change.
That makes a lot of sense. It just goes to show you that there's a profound effect when you heal emotions. There's a profound effect on the body, and versus just working on the body. And I guess that's why you included belief and brain as part of the journey.
Yeah, because brain is an aspect that I've always studied for myself, for me to become a better version of myself. But then I've realized that my clients also need this healing. So I've always had brain and body. These two are like, I know them, I understand them, I work very, very well with them. But belief is a new baby.
Okay.
It's
When did you add belief?
just recently.
Mm-hmm.
It's in its infancy.
And it's the result of the 15-year work you've been doing.
Yes.
Mm. So you felt like this would be the last piece of the puzzle.
Yeah, because it again, it will supercharge my treatments. It's the missing piece, because then when I saw women that needed this, I would be like, well, go to her, or contact this person, because they needed that. I could see that they needed it. But because they had developed that trust in me, and also I have gone through it. It's not that when a woman comes and she's been through miscarriage, I just hold her hand and I go, I understand what you're saying, because I've been through it, and there's so much power in that. But again, I had to understand that I am capable enough to hold space with that as well. So I had to work on myself. And I had to work on myself as in I had to work on my belief. Because I understand that every miscarriage and even the struggle of infertility, I have developed blocks.
Emotional blocks.
Yeah. I have developed emotional blocks that I need to unblock and unpick. And when I choose to go to a healer and I choose to go and understand something, because sometimes I will experience a certain modality, and then I will study that modality, and then I will try and understand how can I now use this tool to help my ladies. But ultimately, I'm helping myself. I'm very selfish.
You're very caring.
Yes, you have to, because
I'm selfish.
Yeah, I'm working on my own womb. I'm working on my own womb. I have to care for myself. I'm forced to do that.
Well, I don't think you're forced. I think you want to.
Yes, because again, it's integrity, isn't it?
And also, with emotional healing, I meet my clients as deep as I can meet myself. So I guess it's the same for you.
Yes.
You meet your clients as deep as you have met yourself.
Yes.
Yeah, it is really important to do the inner work and the work required for you to hold the space for these women to heal safely and to conceive successfully.
100%.
You've had 5 miscarriages. How did you navigate going from one to the next? Because I imagine that by the time you reached the 5th one, you probably had so much emotional healing to be done, and physical healing as well. And you did mention earlier that the doctor said, enough. Why did she say that? And what made her tell your husband and your sister that you need to stop?
So when the first miscarriage happened, it was in the middle of my brother just about to get married. And I was actually in London. And we were shopping for my brother's wedding. And I when I go to, it's called Ilford Lane in London, I can stand on the spot where I miscarried.
Wow.
Right, I can if I want to. And I remember one of the night before, our auntie, she put her hand on me and said, "Good news." And at that time, I didn't really want to tell anyone I was pregnant. And so within that miscarriage, it was a very hard miscarriage, but Allah facilitated. I had a cousin with me who had gone through a miscarriage, and she was a lot younger than me. And subhanallah, in the UK, we have the NHS, which is beautiful, but it did fail me because we were put in a store cupboard because there weren't enough people to attend to me. And it was a very, very traumatic experience. And so with that first miscarriage, but the beauty was that I was grieving, but my husband was with his sister. And he was, when he had to become my support. And after he supported me, I was told later on that he went and he just cried in his sister's arms. Because I don't think you really expect, or you don't really process that the man is going through loss as well.
Oh, yeah, they are. But it's just because we're not used to allowing men's emotions, or even like they're also not used to expressing
But he
their
was he was in a
emotions.
safe space because he was with his sister, and I think that was a big rahmah, a big blessing from Allah,
It was a mercy.
a big mercy from my husband.
Because he was able to express his sorrow and
Yes.
grief.
Yeah. My second miscarriage, I was in the UK and I was in my hometown, and we had a scan and there was no heartbeat. So they said that I had to go up, and I remember having to take the tablet. It's so difficult. You want a child, but yet you have to take this tablet, and this tablet will make you miscarry. It's so unimaginable.
It's unsettling.
It's so unsettling. The third miscarriage, my husband and the kids and my mum were meant to go to a wedding in Germany, and they were going to go by road. And me being the warrior I am, I was like, no, don't miss the wedding, you go. And then one of my friends looked after me and she was like, Shanela, I can't be physically at your house. So then I drove to her house and I spent a few days with her, and she was very nurturing. But I also blocked.
You've already had the miscarriage at that point.
Yeah.
And you let your husband and your mom leave
Yes.
because you got it.
Yeah, because I got this. I'm strong. It's only a miscarriage.
Wow. And it was only the third miscarriage.
Yeah.
Wow.
The fourth miscarriage was when I learned to say, I need help.
Why?
Because it was just too much.
What was too much?
The weight. The weight. Because by this time, I had become so good. If I wanted to get pregnant, it would only take me 2 months to get pregnant. I was so good with the science of it, with the ovulation. I really, really understood my body. But it was the emotional problem. It was the weight of, why is this happening? Like, the science is correct. Why aren't I conceiving? I am conceiving. Why isn't my body keeping this baby? And I was so angry. And I remember telling my husband that, listen, I just want you to hug me and I just want to cry. I just gave him clear instructions, and that's what he did. With that one, I was just in my bedroom and I just stayed silent, and I just really went inwards, and I became really good at grief, like witnessing my grief. And when I look back at it, I understand that the first three, I wasn't allowing my body to grieve.
What's the timeline?
Every year.
Every single year?
Yeah.
For 5 years?
Yes. Because I got really good at so I would give myself about 6 months. So every miscarriage I had a ritual. So I had to have hijama. I had to have a haircut.
Hijama is cupping.
Yeah, cupping. And then I had to have a haircut, and I had to like the cutting of the hair. It was just like a upgrade for me. It would take me about 3-4 months, and I would then start looking after my womb.
And at that point, you were already a therapist.
Yes, I was already.
So you would heal yourself like you would do what you would do for a client.
Yeah. Well, I was developing my techniques, but whichever teacher I would go to, I would ask the one question: how does this help with infertility? Like, how can I now use this technique to help with the womb? That would be always the question I asked.
Did you want to help yourself by learning like all the modalities that you've learned?
Yes.
So you still wanted to get pregnant after the 5th miscarriage?
Yes. Because the 5th miscarriage, the doctor said that my uterus is totally mashed, and that if I get pregnant again, either I lose my life or the baby's life is lost. And Islamically, when a medical profession has said that now this is in danger to my body, that I can die now if I get pregnant again, so I had to make the opposite dua.
Because your body is amana, right?
Yes.
It is in your, like, your body is something given to you to take care of.
Yes. And now I'm doing the opposite. I'm saying, Ya Rab, let me accept that another baby is not in my qadr.
Not in your destiny.
It's not in my destiny. And I'm just like, it took a year of dua, a year of acceptance, or maybe a year or 2 years. The timeline blurs. But I remember like feeling that, and then acceptance came. And after acceptance, it was like, okay, now I've learnt. Like, can you imagine that I want to get pregnant and I can get pregnant within 2 to 3 months easily?
And that's what you started doing for others.
Yeah, because I had developed the technique. The protocol was there. I understood what I needed to do.
Yeah.
And so I thought, okay. And again, I was a normal hijama practitioner. I did acupuncture, and I didn't really think about, like, let me specialize in fertility. And then I went on a business course, and that was in December 2019. And I had already got people pregnant successfully, but I hadn't dived into it or specialized into it. And the coach was like, what gives you joy in your business? And I was like, when someone gives me a positive pregnancy test. And she said, I can't see it on your social media. I was like, what? I said, what? I meant to. And that was then my journey of becoming like a walking, talking fertility expert and shouting about my protocol, because it had worked for so many people. And I felt as though it was at that point where I can now shout about it. I can now advertise it, because it comes with truth and reality.
And it's not like you stumbled on it. Like, you actually researched and you studied and you learned and you practiced and you implemented. So it's not as if it was handed to you. It was something that you worked hard for, but you didn't necessarily see that, oh, like, this is what I specialize in. Because this is where, like, I get a lot of success stories.
Yeah.
So, well, I'm really, really happy that you're doing what you're doing. And I really appreciate this honest conversation that we've had, and that you shared such a deeply personal part of your journey. But I think this is why so many women can trust you with their own infertility struggles, because you've walked the walk, and they can trust that you can help them with successful pregnancies. How and where can people find you?
So primarily you can get in touch with me on Instagram. I am called Holistic Pin Cups, and I would advise you just to DM me, and then we can start talking about how I can help you and what treatment to book.
Amazing. Thank you so much, Shanela, for being here, and thank you for this honest and candid conversation. Everybody, follow Shanela. If you enjoyed this episode, like, subscribe, and share it with anyone you know is going to benefit from what we talked about today.
Thank you.